Focus, we've been following the scandal at VA hospitals across the country since whistleblowers started reporting the problems months ago. Tonight, the head of the country's Veterans Affairs is visiting Baltimore to talk about our vets' health.
The scandal over long wait times started in other states. In an interview last month, the chief of staff for the VA Maryland healthcare system told us wait times weren't a problem here in Maryland, although last week's audit proved otherwise.
In 2 weeks, if it is not an urgent case.
Okay.
If it is an emergent or an urgent case, they can come and be seen that day.
Now, some veterans can get an appointment within 2 weeks here in Baltimore, but that audit from the VA showed at Baltimore's VA, vets who are new patients wait an average of 81 days for an appointment with a primary care doctor. The VA told us existing patients shouldn't have a problem, and they could be seen in most cases in less than 2 weeks. Last night on In Focus, we introduced you to Army veteran Edward Jolson. He was told he would be waiting until September for an appointment with his primary care doctor. He's been seeing that physician for a decade.
It's unfair that you fight for your country, whatever war you're fighting in. And the government which says, we'll take care of you, do not worry, blah, blah, blah. And you who walk around saying, hey, I get my prescriptions through the government and paid for by them for the most part, I did everything, and then all of a sudden you find out it's not so. And that's the crash that bothered me.
Jolson was also originally told he'd have to wait 3 months to see an audiologist. But after our story aired, that appointment was moved up to next week. Now, as of yesterday, the VA was still telling Jolson they couldn't get him in for a primary care appointment until the September date. That all changed today. His daughter, Robin Jolson, tells me the head of the VA Lock Raven facility saw our story here on In Focus last night and was able to move his appointment up to next week. Jolson says the VA was extremely apologetic and reassured her that this is not how they treat their veterans. In a news conference today, Acting Secretary of Veterans Affairs Sloan Gibson said changes are on the way. He met with the commission this morning that aims to find the next head of Veterans Health Administration. He says that's the #1 job in government today, and the position will have a greater opportunity for impact than any other job within healthcare. He says he made the trip from D.C. to Baltimore because of our long wait times. Again, the average wait time for new patients seeking primary care here in Baltimore is right around 81 days. But he says even that is a problem. We shouldn't be looking at average numbers because within those averages are veterans who are waiting much, much longer.
I think everything we do here is built on a foundation of trust. It starts with the trust that we have to earn from our veterans as we deliver on our promise every single day, and the trust of their family members as well. It's also the trust of the American people and their elected representatives. They expect us to be good stewards of the resources that they allocate to us, and we have to continue to earn that trust. I think it's pretty obvious that we've seen a major erosion of that trust in recent times. My commitment to all of you, my commitment to all of our veterans, my commitment to the American people and their elected representatives is that we will work to earn it back. I don't expect that to be easy. I don't expect anybody to give it back. I expect that we'll have to earn it back.
I specifically asked Acting Secretary Gibson about wait times for existing patients. We were told for veterans already in the system, wait times shouldn't be a problem and waits should be 2 weeks or less. I mentioned Jolson's situation of being with the VA for a decade and waiting 3 months. Gibson acknowledged the wait and says it concerns him, and they need to focus on these veterans that are waiting so long. He talked about creating a system in which veterans can give real-time feedback so the VA can see and deal with issues in a timely manner. He also says 5 new primary care physicians will be brought on board as soon as possible. This will allow around 6,000 more patients to be seen each year. You can see more changes the VA is proposing on the full story that's on our website, abc2news.com/infocus.